Hi Regina, my name's Phoebe Deans-Gibson and I'm going to be giving a talk on lung cancer today. The purpose of the talk is to inform the audience about lung cancer and the need for annual screening, and the target audience would be the general population or perhaps people that just want to find out a little bit more about lung cancer. Okay. When we hear the word cancer, most of us have some type of emotional response, whether it be fear, anger, sadness, loss, hope, survival, or strength. Most of us feel something, as most of us have been affected with this disease. Whether it be through our own battle or the battle of a loved one, this six-letter word has impacted our lives. When we think about the types of cancer, which types do you think are the most common? Breast, prostate, bowel, skin? And you would be right. These are the most commonly diagnosed cancers. Why do you think we as a public know that? Is it through education, TV advertising, or perhaps simply the fact that we know someone or have heard of someone that has been diagnosed with this type of cancer? What about awareness due to national screening programs? If there is a screening program for a specific type of cancer, then it's okay to think that it must be really common or dangerous, right? Keeping this in mind, which type of cancer do you think claims the most lives every year? Breast, prostate, bowel, skin? The answer is none of those. Lung cancer is the leading cause of death in Australia and worldwide, yet still we do not have a screening program. I'm going to talk to you today about lung cancer. I'll give you an overview of what cancer is and how it grows, then specifically the types of lung cancer, the statistics, the symptoms, and discuss the need for annual screening. To begin, I've got a short medical animation which highlights what cancer is and how it grows.
The human body is composed of millions of cells that vary in size, shape, and function. Cells are the building blocks of all the different tissues within the body. In healthy tissues, new cells are created during cell division, a process called mitosis. When cells become old, they self-destruct and die, a process called apoptosis. A delicate balance must exist between the rate at which new cells are created and the rate at which old cells die. Cancer develops when the balance is disrupted and cells grow out of control. This disruption can result from uncontrolled cell growth or loss of a cell's ability to self-destruct, resulting in a mass of cells or a tumor. A benign or non-cancerous tumor is the erratic growth of normal-appearing cells. These cells are contained at the original site of growth. However, malignant cancerous cells can migrate or metastasize to another part of the body via the circulatory or lymphatic systems and form new tumors at these locations. Cancers are named after the site where the cancer began, which is referred to as the primary site. If lung cancer spreads to the brain tumor is considered metastatic lung cancer, not brain cancer. The brain tumor is considered the secondary site.
So, we know that cancer is basically the growth of abnormal cells. Lung cancers fall into two main categories, either small cell lung cancer or non-small cell lung cancer. Small cell lung cancers are less common, but their cells grow and divide rapidly when compared to non-small cell lung cancer. Non-small cell lung cancer is the most common, accounting for 80 to 85% of all lung cancers. These are further classified into three subtypes: adenocarcinoma, squamous cell carcinoma, or large cell carcinoma, depending on the cell type affected. When lung cancer is diagnosed, doctors will assign the cancerous stage, which highlights how much cancer is in the body and where it is located. Now, for this part of the presentation, I'm going to need a volunteer from the audience. Okay, so George has offered to volunteer. George is a very good volunteer because he doesn't talk much. So when we go through the stages of lung cancer, stage 1 lung cancer is when there is a single primary tumour in one affected lobe of the lung. Stage 2 cancer is when the single primary tumour has spread to nearby lymph nodes in the affected lung. Stage 3A is when the primary tumour has spread to nearby lymph nodes, but it also has spread to lymph nodes in the centre of the chest. These are known as the mediastinal lymph nodes. In stage 3A, the primary tumour may also have invaded the chest wall. In stage 3B, the primary tumour has spread to nearby lymph nodes, the lymph nodes in the centre of the chest, and have moved across to the opposite side of the chest, the mediastinal lymph nodes in the opposite side of the chest. With stage 3B, secondary primary tumours may have also started growing in the opposite lung. When a cancer has reached stage 4, that means that it has spread to distant parts of the body. So this may be the bones or the brain or the liver. Thank you very much, George. You may have a seat. So whilst I'm not going to talk to you today about the treatments for lung cancer, the general rule of thumb is that if the cancer hasn't spread, then surgery is an option, and that offers the best possible chance at cure. If a patient is diagnosed at stage 1, that is where there is a single primary tumour and it hasn't spread to the rest of the body, there is a 90% chance of curing the cancer with surgery. However, 70% of patients are diagnosed at stage 3 or 4. That is where the cancer has already spread to distant parts of the body, and treatment can only try and stop the disease progression rather than cure it. If a patient is diagnosed at stage 3 or 4, the 5-year survival rate is less than 10%. The chance of being alive at 15 months after diagnosis is 50%. The Australian Bureau of Statistics highlights that lung cancer is the leading cause of death in Australia and the 5th most commonly diagnosed cancer. The Australian Institute of Health and Welfare highlights that the lung cancer deaths will equate for 18.9% of all cancer-related deaths. That is more deaths due to lung cancer than breast, ovarian, and prostate cancer combined. Over 9,000 people dying from lung cancer this year, and yet we still don't have a screening program. So we've established that lung cancer is a dangerous cancer, and the only way of curing it is to catch it in the early stages of the disease. So let's have a look at the symptoms. Symptoms of lung cancer can vary, as with all cancers, but may include breathlessness, a persistent cough or chest infection, hoarseness in the voice, fatigue, or weight loss. It is important to note that not all people experience obvious symptoms, and some people do not experience any symptoms at all. The lack of clear warning signs means that most people are not diagnosed until the much later stages of the disease, where treatment options are not able to cure the disease. I want to share with you my experience with lung cancer. 1 year ago, my son woke me up to tell me my mum had collapsed on the bathroom floor. I found her grey and barely conscious. As a nurse, I did what any nurse would do and checked her vital signs, her blood pressure, her heart rate, her respiratory rate, and her temperature. Her blood pressure was slightly elevated, but nothing significant. When my mum came to, she said that she'd experienced a sharp shooting pain across her chest. I suspected that she'd had a heart attack. After 6 hours in the emergency department and all tests for a heart attack inconclusive, protocol requires that a chest X-ray be attended before admission to the ward for monitoring. That chest X-ray changed our lives. It showed a 10 by 10 centimetre left upper lobe mass. The next few weeks went by in a blur with numerous doctor's appointments and scans, blood tests, and 2 biopsies before the final diagnosis. Stage 3B adenocarcinoma, non-small cell lung cancer. The doctors told us that my mum had 12 to 24 months to live with treatment. Since the diagnosis, my mum has undergone 6 months of chemotherapy, fortnightly blood tests, countless doctor's appointments and scans, immunotherapy, and radiation. Last month, they told us that my mum had progressed to stage 4 despite treatment interventions. My mum is 58. She had no symptoms until that night she collapsed in the bathroom. She is fit, healthy, led an active lifestyle, and she never smoked. My mum will die from lung cancer. If she had been screened earlier, they would have caught the cancer earlier and she would have a chance at cure. For many years, doctors have known that screening for certain cancers saves lives. In Australia, we currently have 3 national screening programs: breast screen, bowel screen, and cervical screen. The Australian Institute of Health and Welfare describes the aim of population-based screening is to detect the cancer at an earlier stage where treatment options are more effective, or to detect and treat abnormalities in which, if left, may become cancerous. Screening for lung cancer makes sense, as the symptoms are not often present until the later stages of the disease, and therefore treatment can only try and stop the disease rather than cure it. Efforts have been made for decades to try and screen for lung cancer by looking at phlegm samples to see if cancer cells can be detected in the phlegm, and by chest X-rays. However, none of these were able to show a clear reduction in mortality due to lung cancer. Chest X-rays were good at detecting lung cancers, but often in the later stages of the disease, and many stage 1 lung cancers were left undetected. So now I've got a little activity for us to complete. We're going to have a look at some chest X-rays and see if we can spot some lung cancers. Okay, so I'll just go back. So this is a chest X-ray. You can clearly see, as it's got labels on it, the left lung, the right lung. This is the heart, this shape down here, and this round irregular circle shape is a cancer. So on the next X-ray, it's still pretty easy to spot, isn't it? Even without the annotations. The round, irregular, circular shape. So I'll have a look. Oh, it is important to note that these 2 X-rays show a stage 4 cancer, and it's already spread. So even though it might be easy to spot, it's already gone too far for it to be cured. How about this 3rd X-ray? A bit harder, no cancer, impossible to spot. What if I told you there was a 1.2 centimetre right lower lobe nodule? Still impossible to see? What if I gave you some help? Still impossible? Remember, this is a stage 1 cancer, and if we can catch it, we can cure it at this stage and save someone's life. Still impossible? Let's compare it with a low-density CT. Easy, isn't it? This is the same stage 1 cancer on the low-density CT as you can't see over here on the chest X-ray. So it's pretty obvious that scanning with low-density CT offers an alternative to previously attempted screening methods, and it works. In fact, screening for lung cancer using low-density CT is already used in the US and funded through Medicare, following the release of the most impressive research. The National Cancer Institute funded a randomized trial to determine whether screening with low-density CT, when compared with a chest X-ray, would decrease lung cancer mortality in high-risk persons. The National Lung Cancer Screening Trial, conducted in the US, published its results in 2011. It conducted a large-scale trial over 2 years involving over 50,000 participants from 33 US medical centers and followed them for approximately 7 years. 2 groups of 26,000 were assigned to undergo 3 annual screenings, either with low-density CT or chest X-rays. The results were impressive. A 20% decrease in mortality from lung cancer when low-density CT screening was used. A 20% reduction in mortality is a huge figure and accounts for 1 prevented death per 320 patients screened. In comparison, it takes 1,339 patients to be screened with a mammogram to prevent 1 breast cancer death and 817 patients to be screened with a colonoscopy to prevent 1 colorectal cancer death. Despite this impressive research, Australia does still not have a screening program. The Australian Government's Standing Committee on Screening released a position statement regarding screening for lung cancer using low-density CT in 2015. It highlighted that even though there was high evidence to support screening with low-density CT, it would not support such program at this time. How many more people have to die from lung cancer before an effective screening strategy is introduced? In conclusion, lung cancer is a major global health problem. It is the leading cause of death in Australia and worldwide and accounts for 18.9% of all cancer-related deaths. The lack of symptoms until the later stages of the disease means that treatment options cannot hope to cure it. We need to try and detect lung cancer at an earlier stage where surgery is possible. We know that early detection saves lives. Studies have shown that screening with low-density CT can reduce lung cancer mortality by 20%. Implementing a national screening method in Australia using low-density CT is of the utmost importance in order to allow earlier detection of lung cancer and therefore improve treatment options and offer the best possible chance of cure. Thank you for your attention today. Is there any questions?